Thank you so much, Renita Das. Moving on to the next one. Today we cover all important stages of life cycle of the woman, and we are starting the conversation with the most underserved population, the elder woman. Let us go straight in this very special panel discussion, Unveiling the Unseen. Caring for the invisible woman, a focus on women aged 65 plus. We have the honor to bring the finest and the most seasoned experts in elder care for you. So ladies and gentlemen, please put your hands together for Dr. Radha S. Murthy, co-founder and managing trustee, Nightingale's Medical Trust. Can we have you on the stage, ma'am, please? And also a huge round of applause for Dr. Uma Nambiar, CEO, Bagchi, Parthasarathi Hospital, Indian Institute of Science, Bangalore. We also have along with us Dr. Dirk Deacon, Staff Director of Care and Welfare, SVRZ, Service Centrum, Netherlands. He will be joining us online. Can we all also give him a huge round of applause? Thank you. And the moderator of this panel is Dr. Arvind Kasturi, Team Leader, Geriatric Center Project, St. John's Medical College, Bangalore. Can we all give him a huge round of applause? Thank you.
It's a dangerous proposition. We have Dirk with us. We can see him here, but I don't know if you can see him there. So good morning once again, and welcome to this panel discussion. The topic that we are talking about is Unveiling the Unseen, Caring for the Invisible Women, a focus on women aged 65 and above. The sub-themes under this are dementia in women, geriatric care, and assisted care with medical technology and innovation. Now I understand when we have a panel discussion, the watch is the guiding force behind the whole thing. We have a time of about 30 minutes for this panel discussion, and we'll try to stick to that norm. Very, very happy to have with us Dr. Radha Murthy. She's been introduced to you, an old friend of St. John's and the co-founder and managing trustee of Nightingale's Medical Trust. Dr. Uma is here on my side, the CEO of the new Bagchi Parthasarathi Hospital at Indian Institute of Science. And there's Dr. Dirk. Dr. Dirk, could you give us a sign? There he is. Okay, so you can see him. Wonderful. Dr. Dirk, you can hear us?
Yes, I can hear you.
Wonderful.
Good morning. Very nice to be here.
Wonderful, wonderful. Welcome to you, Dr. Dirk Deacon, Staff Director and Care of Welfare, SVRZ Service Centrum in the Netherlands. Well, just before we start popping questions at these distinguished panelists here, I think we need to set the trend of what we're talking about. And when we talk about the older woman or a senior person, I think it is good for all of us to understand the demographics and where we are at in this country with respect to our senior citizens. Now in India, there are usually 4 or 5 aspects or points or issues as far as senior citizens are concerned, which I would bring to the table now, just to set the context for the discussion today. The first point is that the size of the senior citizen population, and for now, I will be including both genders, is large. The size of any population in India is large because we have a huge denominator. But the size of the senior citizen population today, 2021, we did not have a decadal census in 2021, but we expect it to be about 149 million people aged 60 and above, which is the cutoff for senior citizens in this country. Now 149 million, millions roll off our tongues in Indian public health like fine malt whiskey because we have so many of them. But just consider the number of 149 million senior citizens. That's more than the combined total populations of the UK, Australia, New Zealand, and perhaps a few European countries put together. And that's just the senior citizen population. Not just large, but that population is growing. Now, today, the proportion of senior citizens in the Indian population is about 10.4%. And that is poised to grow to 20.8% by 2050, which means that 1 in 5 Indian citizens will be a senior citizen. And you can imagine the strain that is going to place on our care systems for elder care in this country. So it's a large and a growing population that we are talking about. Now, bringing into focus what we are talking about today, which is the Indian older woman, the feminization of the older population is another demographic characteristic which is being spoken of today. Now, the sex ratio in the population, which is the number of women per 1,000 men, in the general population is about 958 women per 1,000 men. And it's an adverse sex ratio because it shouldn't be like that. It should be actually a little above 1,000. But the sex ratio in the population 60 and above is almost 1,078 women per 1,000 men, which means that the older population has more women than older men. And that's a point that we all need to remember. Another vulnerable subpopulation within the population of senior citizens is the single older woman. Now, of all older men, of all men aged 60 years and above, about 15% are single, which means they have lost their spouse or they are single. But of all older women, 49.8% are single, which means that the single older woman is a demographic which is of particular importance when we look at the canvas of senior citizens and elder care in this country. Now, that is the demographic that we are talking about today in this panel. We are focusing on the senior citizen and within them, the senior citizen woman. And there are, like Renita very well, I think that was a lovely keynote address. It placed in perspective many issues confronting women and many opportunities for work and growth. So thank you for that. And in that backdrop, we now have our very interesting panelists answering questions that are being put to them on specific areas of work which they come from and which they are involved with. So with that backdrop, with that canvas, let's start this panel discussion by asking a few questions to our panelists and handing the mic over to them. I will, like I said, consider yourself warned that I will be looking at my clock and that I will probably shift our panelists here and there, depending upon how much time we have in this session. And if we are fortunate to have some time left at the end, we would love to answer a question or two from all of you as well. So first, let me start off by asking Dr. Radha Murthy, who is the co-founder of Nightingale's Medical Service Trust, a very, very respected and well-known organization working for the welfare of senior citizens from a healthcare perspective in this city from 1998. So, Dr. Radha, she is a doctor. I'm very happy to say that she is an alumna of the institution I currently work in. I'm from St. John's Medical College Hospital, and Dr. Radha is an alumna of the batch of 1970. So, Dr. Radha, in your work with the older population in general, and taking today's focus on the older woman, could you give us a brief perspective on mental health issues? Which was one of the things our keynote.
Where are we going now?
Which was one of the things our keynote speaker spoke about.
So, madam, afternoon, somebody told me.
That is city campus. Now we have a
Would you-
we are also not. So
Okay.
they
Never mind, don't worry.
So
that
we
must
don't
be
have,
good.
no?
Okay. Would you be able to throw a light on, based on your work with older women, what are some of the mental health issues and the perspective on the mental health status of the older woman? You've got a mic, does it work?
Good morning.
Yes.
Good morning to all of you, and thank you, Arvid, for this introduction. As he said already, that I've been working for the elderly for the past from 1996, and my insight is Earlier, I found that there was not much priority for elderly. And when we started, they said, why elderly? I mean, whether there are other subjects to be looked into. But now, as I said, the population has really grown, and not only the numbers, but also the problems have come up. And we are still not geared up to do many of them. So, coming to mental health, as I mentioned immediately, I just wanted to, because I didn't want to take a long time, mental issues. Mental issue is not spoken much about. As we said, it's a huge subject, but poorly diagnosed, people do not approach and do not want to talk about it. So there's a lot of stigma attached to mental health itself. But now it's slowly gaining importance. So, what do you say about mental health? What is mental health and what do you feel? It's a big myriad. It consists of emotions, it consists of your thoughts, and how you deal with it. Now, when you say good mental health, is people are able to cope up with it, with your thoughts, with your emotions, you're able to cope up with it. And it's called good mental health. But a stage appears where your thoughts, your emotions, and you're not able to cope with it, as well as it leads to quality of life which is poor. That's where you, and how do you face it? So this is the crux of, mental health issues or disorders, what you call as. Now, my main focus is on the elderly. Elderly, as I said already, they make up of about 55% of the population, and 53 people are in the developing countries. Elderly women, as it is mental health issues when it comes to, there are other, most of the time it is focused on the men. As I said, feminism or the shift towards the woman is very poor. And the women do not talk about it much. The main issues in the elderly women are depression and dementia, which is the most important mental health issues. The others are like mood swings, where it is bipolar, where there are stress, where there is, and also you can see about the abuse, what you talk about the substance abuse like alcohol. So let us focus on my main work is on dementia, but let me come back to you as to why women go through more of depression, which can lead to dementia also. As you say, when women outlive the men, so the numbers are huge, and they have to live alone, especially when they lose their spouses. Most of the spouses are much older, so the loss of the spouses, living alone, social interaction is very, very poor. When we say we are not talking about the urban, let's not talk about the urban so much as the rural and people in the lower sector. So there's not much of social interaction, and they are withdrawn. So what is more about the depression is that loneliness, isolation, so this leads to sort of a depression which is not diagnosed at all. Very many times it's never diagnosed. And long-standing depression can lead to dementia. Now when it comes to dementia, it's a very, very, I don't know, most of you all will be knowing about dementia, I don't have to talk about it, but that it's a neurodegenerative state wherein a person not only loses memory, but also not unable to carry on their daily activities. Imagine if you cannot do your daily activities, it leads to a lot of difficulty, is because it's not only that you're dependent, but also the family suffers along with it. And the dementia is irreversible. So you can imagine the pathetic stage of what it is, and the cost of care of looking of people with dementia. So mental health issues have to be, at least my advice is to have, how do you prevent these mental health issues? So active aging, which is becoming very, very popular now, 3 things which have to be taken care is socialization, physical exercises, and cognitive exercises, which could keep away many of the issues away. I'm not going into great details because we will be coming forward and up for the various subjects. But as I said, it's very complex and people have to, the stigma should be taken off and people should be more aware of mental health issues of the elderly.
Thank you, Dr. Radha. That was a kind of a bird's eye view from the experience that she has had in her organization of reaching out to elderly people of mental health issues and dementia. Now, dementia, we'll be coming back to her shortly. She leads what's known as the Dementia India Alliance, so we will be talking about that shortly. Let's move on now to our next panelist. Again, a very distinguished person in our midst, Dr. Uma Nambiar, who is the CEO of the Bagchi Parthasarathi Hospital at Indian Institute of Science. Ma'am, having led several hospitals in India, Dr. Uma comes with a rich experience of leadership in healthcare, not just being a medical doctor herself. Having led several hospitals in India, how do you think Indian hospitals can improve on technology, the use of technology in the context of looking after, I know it's a somewhat convoluted thread, but technology, hospital, older woman. How do you put these three together in your experience with managing hospitals?
Thank you, Dr. Arvind. It's an interesting and, as he rightly said, extremely convoluted way of, trying to see how technology and women's health can work together. So just to start with, I would segue from what you said, that we have 49% of the single women in the geriatric population. And I would like to put my observations here in Kerala. I come from Kerala. The number is way beyond 49%. And my worry is that as our health indices across the country improve, would we be then having far more number of single women in the elderly? Because when you go to every house in Kerala, every second house probably has 80 plus women, hardly any senior men. And this is my personal observation across the years. And Kerala has extremely good health indices. So I'm just trying to put that across the country, and I think we will then be looking at how to engage with senior women like this. Now, number one thing that I would want is that, see, in hospitals, I was sharing with them before, that geriatric medicine as a specialty itself in hospitals is available in very limited hospitals. So first of all, we have to understand that this specialty is need of the hour. We are not going to be a young country for too long. We are going to be a country of the older people sooner than later, and we should be prepared. If the number of MD geriatric medicine seats is anything to go by, we will not be prepared to handle what we are going to get in number of senior people. I started an experiment in 2004 to set up a geriatric medicine department and failed, because that person could not succeed here because of the peer pressure, the unaware this thing of the population, and the patients not ready to accept all that. So that's one. So the hospitals have to set up geriatric medicine departments. Hospitals per se, even
Recording
for
in
separate
progress.
Women's health department, are very poor. Even today, most hospitals look at women's health as maternity and child health department. We have not learned to look beyond our hormones and uterus and ovaries and breast diseases for women. We have not started. So from what Ritika said, to set the context, she's very right. So we are almost like saying that we think that 33% of the seats should be reserved for women, so 33% of the body is all women's health. That's not the truth. We are 100%. So I think we need to really look at that in the context and say that, okay, women's health. So there are countries where you have hospital for women, which are not maternity and the reproductive organs and the breast hospitals. They are complete women's hospital. So do we have women's hospital like this? For a country this size, we have hardly any. We can probably count 2 or 3 on our fingertips. And there again, how much priority we give to women's health. So I think that's something that we need to look at. Every hospital needs to look at that. Now coming to how technology can assist us. The big gaps in delivery of healthcare, and as we get more and more senior, we need to get to home care, because every senior citizen cannot be brought to the hospital, and also need not be brought to the hospital. The hospitals of the future will be centers only for acute care and research. Healthcare will move to homes or where the people are. As that happens, we need to reach out to people. Conventionally, why women do not seek health care in hospitals is because the decision to seek health care, or the healthcare related decisions in most households, are made by men, and therefore women do not go out to the hospitals. That's one more reason. So why can't we use technology to reach people at home?
Recording in progress.
The moment we start reaching people at home, every single person will start getting covered, and that will be inclusive of all women as well. As we move forward with various technologies in terms of remote diagnosis and remote care, this would pave the way for being inclusive of all the women, and therefore as we talk about senior women, they will also get included. That's how I would think that we would reach there. Yeah.
Yes, thank you, ma'am. Absolutely. I mean, the case of the state of Kerala is a very, very interesting one, because it represents what the rest of the country is going to look like in terms of the demographic of senior citizens as we go forward. And in fact, a couple of other relevant details about the senior citizen population. We must remember that in this country, as per the 2011 census, we haven't had one after that, 71.4% of our senior citizen population is rural. So we may, like I keep telling my colleagues in St. John's, it's not enough to think of Koramangala 4th block. There is a whole country beyond that, that we have to think about, especially in public health, which is where I come from. So that's also a statistic that we need to keep in mind. There's another one, which is how many of our seniors are dependent. Now, I won't answer that question, but we have an indicator called the old age dependency ratio. Now, what that is simply how many people aged 65 and above for every 100 people aged 15 to 64. That's the old age dependency ratio. And in this country, that ratio is rising. And today, it's about 20 to 21%, which means that there are 21 older persons for every 100 in the 15 to 64 age group. And that is rising, climbing, which means that slowly the gap is sort of narrowing. And in the world, another very sobering statistic to present before all of you is when we reach the year 2050, globally, the number of people aged 60 and above is going to, for the first time in history, exceed the number of children 0 to 14. So it's a demographic engine that is slowly progressing, not even slowly, progressing fairly rapidly, and that we must all be prepared for. Anyway, with that, let's move on to our third panelist, Dr. Dirk, who's joined us, and you can see him there. Hello, Dr. Dirk. Hello once again. And Dr. Dirk comes from an environment where actually he is working with an organization which cares for senior citizens in the Netherlands. So, Dr. Dirk, the question that was prepared for him is there a global model for care of older women that works for all, or is it country and culture specific? In other words, what is the model of care that we have in your country, Dr. Dirk, for the care of older women? And do you think that there is a one-size-fits-all approach here, or does it have to be country and culture specific? Yes, sir, over to you.
Yes, can you hear me?
Perfectly. Please go ahead.
Good. Well, I think the first thing that I would like to say is really that we should have a kind of a positive frame to start with on elderly, right? Because before we know, we start to see being elder as a problem, but actually I think it is a big blessing, right? It means we are still there. It means we have a healthy population that is over 60 plus. So I think the first point in like framing the issue is really to view it from a very positive angle, that we are now in a state in the global health that we actually have the opportunity to focus at this group, a group where, yes, there are a lot of problems, of course, arising, but also a large percentage of this group is still quite healthy. Of course, there's variety per country. So the first point I would like to make is that a care model and elderly, do all elderly need care? I don't think so. If I look to my country, most of elderly actually are active aging, and I won't like to frame them as being sick, right, or needing a doctor. So the first point in terms of the model of care, I think we should be careful by talking about care before we actually know the need that an elderly person really has. So elderly is really, I think, a big word. We might need to look a bit more specific if there is a disease. And for example, with dementia, to have the information about the diagnosis, to have awareness in society of what dementia actually is, to have a kind of pathway, and I'm a bit careful to say care pathway, but we need to have a pathway where people with dementia, as I would like to call them, right, are kind of taken care for. And currently, I think, at one hand, there is a need to come up with a diagnosis and to focus on, are you actually sick? Because if you are sick, we can treat you and we can put you in a pathway. But at the same time, framing people as having an issue is also like adding to that stigma. I think that is one of the key points, that focusing, as Renita said at the start, focusing on population health to start with, and then kind of detecting what kind of issues are really a problem with our elder to focus on. I would actually say that if we focus on what we call value-based healthcare, the point to start with really is the diagnosis. And then yes, indeed, within dementia, there are a few like care models that you could do. Then the population where people are, at people's homes, in people's communities, much in the hospital. I think currently we relate mental health and care to hospital care, while actually a lot of dementia is not medical to start with. So it might need care.
Sorry, Dirk, we kind of lost you briefly. Can you hear us?
Yes, now I can hear you again. Can you hear me?
Yes, we can. Sorry, we lost you over the past 2 minutes. Please, go ahead.
Great. Yeah. So I'm not exactly sure where you lost me. Yes, there are differences in the world, but having the awareness around of what diseases are, I think is really a very important point to start with, including possibilities of campaigns that makes it very clear to the population what dementia actually is. I think in many places around the world, getting mad, framing of even activities where you need to go to the police instead of needing love and tender care, I think that is still the situation that many people with dementia actually have issues with. So the awareness of what actually the disease is, I think is very important. But again, I would like to make the distinction between having dementia and the importance of diagnosing dementia and then putting in a proper pathway versus framing all elderly as being frail. Yes, we know there is frailty, but by putting kind of the frailty label to our whole elderly population, I think doesn't make the point clear, and also is kind of losing the fact that we have a lot of elderly is actually a blessing for society. And I think there are many examples. I spent some years of my life in Singapore before at the KK Women's and Children's Hospital. Well, the kind of research that we did there also showed that there is a lot of progress in specific issues all over the world, but also definitely in Asia. And the other example, I spent years in ophthalmology before, being really inspired by the work that Aravind Eye Hospitals has done across India. And, you know, we should be remembered of the fact that Dr. V, the founder, started all this work when he actually finished his work, right, when he was an elderly man. And so you should read that book if you're interested in the story of it. So the wisdom and the riches that elderly and that elderly women bring, I think that should be the first point if we want to focus on the future of care for this group as well.
Thank you, Dirk. In fact, that's very, very, very well put, that we are speaking about elderly, but he's reminding us gently that that is not, we don't have 149 million problems. No, we don't. We have 149 million people aged 60 and above. And like he says, that is a blessing, no doubt about it. And in fact, one of the characteristics of older people, when you cut your teeth in geriatric medicine that you're taught, is the phenomenon of heterogeneity, which means that they're not similar. You have a 65-year-old person who probably is a little frail or is a little weak, but you have a 78-year-old person who takes the world in his stride and leads a very healthy and productive life indeed. So thank you for reminding us, Dirk, about that characteristic of the elderly. Well, like I did say, we are at 10:26, which means that we have very little time left in this panel discussion. We have a few follow-up questions for our panelists, and I will request them to kind of limit their answers to maybe just a minute or two. Madam, just a brief word about the Dementia India Alliance, and I know that Karnataka State, in fact, the Health Minister declared dementia a public health priority in the state. So just maybe 2 or 3 pointers as to the way forward in that Dementia India Alliance and the state health policy on dementia.
Quickly, I'll go on to the scenario what dementia is now. There are about 88 lakhs people, and within 2030, we are not talking about numbers as I told you. It's not 88 lakhs people who are suffering, but also equally the same number of families who are suffering. It's very, very difficult to look after them. The cost of care is very, very high. And also, only 10% have been screened. So the numbers what I'm talking about is just 10%. So you can imagine the huge problem of the dementia. Coming to the state of nightingales, when I said about this, my own experiences, though we have tried many things, to bring a comprehensive care by setting up memory screening clinics, by having daycare centers, residential care centers. We have done all these things, respite care, and also prevention of dementia by having active aging programs. But all these support systems which are lacking here are not well spread all over the nation, because there are pockets people are doing in the everywhere. Memory clinics are very few, residential care is very few. So this was not enough. So what more can we do? Now this has to be a nationwide answer for this particular problem. So this is where we started the Dementia India Alliance. Now Dementia India Alliance is a non-profit organization and provides a platform for people with dementia as well as their family. I go on stressing about the family is because they need a lot of support. So this is where I come from, and wanting to have, this is not a priority at beginning, at least for now, dementia. So I went along with the Dimahans to Delhi to meet some of the top officials, like from the scientific advisor, and I also met the health minister. But what they said, that yes, they agree that dementia has to be looked into, but it's too early to make a plan, national plan, and so they advised us, why don't you go back to the state and start it from the state level. So that's how we came back, and along with NIMHANS, Dementia India Alliance, we met the health minister, saying that it's high time that we make it as a public priority. Dementia, you acknowledge it as that. So he actually, Karnataka, I would say, is very, very good in these issues. And he immediately took it up and announced it on the, September 21st that dementia should be a public health priority, which is a very, very great breakthrough for all of us. And through this, it's, I feel much can be done. And what we look for is collaborations from all of us. How do we take this? Now we have made a draft plan. No, we have already made a draft plan, and it is according to the WHO global same plan, focusing on awareness, focusing on diagnosis, focusing on risk reduction, research, training. So all the 6 factors are according to the WHO plan. And if we implement it properly in Karnataka, I'm sure that all the other states will take it up, and thus definitely a national care plan will come through. So this is my appeal to all of you is, like, let us join this movement and see whether we could take this forward.
Thank you.
So, thank you.
ma'am. Thank you for that. Dementia India Alliance, ladies and gentlemen, I think you've got a website, is that right? On
Yes,
the Dementia
we
India
have a
Alliance?
website already,
Yes.
and I can just talk to you all about it later, but I really appeal if you all can join this movement and
Sure.
take it forward.
So that's an invitation to all of you to have a look at the Dementia India Alliance website. Thank you, Dr. Radhamurthy. Dr. Uma, just wrapping up your thoughts on specifically 2 things that the organizers wanted to kind of pick your brains on, which is the Ayushman Bharat digital mission and the whole health registry that is being propagated, that everybody will have a digital health record. What are your thoughts on that?
So, yes, I mean, an ambitious plan that the government of India has. And if all of us in the country have the digital health registry or the ABA number, what we will effectively have is like a cradle to grave document of all the health care episodes and also the wellness episodes documented at one place. So it would be extremely good as the master document for population health. Identification of at-risk population. So if we are, let's say, talking about mental health issues, we will be able to identify people who are prone to dementia and take interventions to either delay or prevent
Recording
the
in
episodes.
progress.
And so this would be, I think, the largest benefit. And just one more sentence on dementia. One of the triggers for, like, say, for senior citizens as the mental abilities decline is, I think, when people remove them from active workplace. Let's say a retirement age. Why would one want to retire at 65 when when we all think that we've just started contributing? So I think the feeling of self-worth and feeling of being needed by the community is an important trigger. And what we should work at is looking at not only social, like increasing their social, let's say, behavior, like improving social behavior and getting them socially engaged and improve in their cognitive behavior and training them, is also to ensure that they are actively engaged in some work and remunerative work, not free volunteer space. Because that importance or self-worth of an individual is an important stimulus to remain intellectually active, and therefore, that's one of the things that I feel we should be doing. Thank you.
Thank you, ma'am. Dr. Dirk, any 1-minute thoughts that you have before we wrap this session up?
Yeah, I fully agree with Dr. Uma. I think that is a very important point. People should know that they are loved human beings who are still able to do the things that they like. And if we can kind of support that, I think we are doing a good job. The other thing where I think India can actually lead the way forward is to really apply technology to elder women. And to really make sure that those concepts, as Renita referred to, digital twins, knowing what a person is when he is 40, 50, 60, before actually the diseases are around, and then enabling people to use those tools, I think India really can lead forward. I spent quite some years in Asia before I came back to Europe, and what I see here that yes, we do have certain healthcare systems in place that will be kind of, ready for one part of the future. But the thing where Europe, for example, I think is really behind, is in speeding up with technology. We are currently working with an Indian company developing voice bots that could potentially be very relevant for dementia. So I really would congratulate India being in position for the coming years and really being the motor for the world in terms of providing the very specific technology that can guide people through the end stages of life and through the elder phase. I think we don't have time to go through the details, but there are many technologies that actually really could help both in rural and urban communities, both in women, but of course also in men, and also both in a more community-focused culture versus a more individualistic culture. Because dementia and elderly, other problems as well, I think they always play a role within the community. And technology could help there, and India has created technology, so you should have a good future in front of you.
Wonderful. Thank you. Thank you for that, and for saying that technology is going to make a difference in the quality of life of older people and older women. Thanks for that, Dr. Dirk. I think with that, we are going to wrap this session up. I think it is past the time that we thought that we would end. So thank you very much, everybody, and organizers for giving us this opportunity to be here and share some thoughts with you on the older population, specifically older women. So with that, thank you very much. Have a lovely rest of the day. Back to the organizers. Thank you.
Thank you so much to all the panelists.